Welcome back to the third and final module of Chapter 14 on health, stress, and coping. So far, I just recorded the last two. I'm kind of recording them all at once just to get them out of the way because I have your second test to continue marking. But this module is slightly shorter than the others and should be a little bit more positive, since in this one we're focusing more on the ways in which we can cope and we can become more resilient when we're faced with stress. So hopefully you find it a little bit more positive than the last two, and hopefully we can also make it a little shorter as well. So this one is on coping and well-being. So first off, we have to kind of define what coping is. So coping is the processes that we use to manage demand, stress, and conflict. Coping strategies can be problem-focused coping or emotion-focused coping. So problem-focused coping involves taking a problem-solving approach. So we cope by defining the problem and working towards a solution. It's very kind of logical and less emotional in nature. So for example, if we are faced with school demands that we're finding really overwhelming, we can basically try to come up with ways to help us solve that problem. So maybe dropping a course, setting a study schedule, or maybe even finding a tutor to work with. Emotion-focused coping, on the other hand, is when we focus more on the emotional effects of a stressor. So unfortunately, not all stressors have identifiable solutions. So for the example, the death of a family pet, obviously there's not something that you can just do, make a list to deal with your grief, but we can find ways to try and help ourselves reduce the negative effects of our emotion. It's important to note that neither of these styles is considered to be kind of more superior than the other. And so their suitability actually depends a lot on the nature of the problem. And in many cases, we use both. So, if you have, say, a family member who dies and you're having a hard time getting over it, as, is natural, then the first kind of coping that you probably engage in is more emotion focused, because, you're dealing with coming to terms with the death and how to deal with that and how it's going to impact your life. So you're going to probably be focusing on your emotions. But over time, if that grief persists, you might actually engage in problem focused coping, to help you kind of get back to normal and to kind of continue engaging in your day-to-day activities. So unfortunately, not all coping strategies actually help. So a lot of the time people will turn to things like substance use or kind of binge eating to help them cope. And as we talked about in the last module, even though they might feel good in the short term, they might activate that reward system in the brain, they're not really going to be effective in helping you coping long term, and they could also be associated with kind of negative health outcomes in and of themselves. So now we'll talk about some positive coping strategies. So there's an area of psychology that's actually known as positive psychology, and it's an area of study that uses scientific methods to study human strengths and potential. And this is actually something that we just recently created a course here at BU about. So there is a positive psychology course now that's taught by Dr. Gadbois. I think it's actually possibly, if I'm not mistaken, being taught for the first time right now, and it definitely seems like it will be a very interesting course if you have room for it in your schedule. And so researchers in this area have identified numerous adaptive and constructive ways in which people cope with problems. And they found that one of the most powerful tools is also one of the simplest, which is simply to try and focus on positive emotion. So positive emotions affects how people perceive and think about the world. Negative mood actually narrows your focus of attention, while positive mood expands it. So we've talked before about the fact, you have mood congruent memory, and it's really, really hard if you're feeling down, if you're feeling low, to try to kind of come up with times when you were feeling happy and times when things were good. And so in that respect, if we're able to kind of focus on changing the emotion and creating more positive emotion, that can actually help us think of more times in which we felt happy and times in which we felt more positive, and can kind of almost reverse that negative feedback loop that sometimes can be associated with negative emotion. So positive moods have also been shown to increase creativity, which is crucial during coping to help reframe stressors into something less upsetting. So reframing is a really powerful kind of cognitive strategy in terms of coping. It allows us to try and think of things in a different light, or reframe them in some way, and it can really help us kind of come to terms with maybe a really negative thing that happened to you. Say someone breaks up with you, and then you start thinking, well, I didn't really like the way they did this anyway, and now I have more time to do the things I like, and maybe I can find another partner who might treat me better in whatever ways. So being able to kind of reframe things in a more positive light can be really, really helpful in terms of emotion. And so there's something called the broaden and build theory, which basically generally states that positive emotions can have the effect of broadening awareness and response to events, as well as helping us build resiliency and coping skills. Positive emotions can actually even have an effect on our autonomic nervous system. So those stress responses we have that are kind of triggered by that sympathetic nervous system, those can actually be influenced and kind of negated in a way by positive emotionality as well. So now we'll talk a bit about optimism and pessimism. I'm sure you've heard these words before, but optimism refers to the tendency to have a favorable, constructive view on situations and to expect positive outcomes. And although it sounds kind of simple and it's a lot easier said than done, being optimistic about things in general is associated with a whole host of really positive outcomes. And then on the opposite side of that, we have something known as pessimism. And pessimism is the tendency to have a negative perception of life and to expect negative outcomes. So it's essentially the opposite of optimism. Pessimists tend to have what's known as a pessimistic explanatory style. So explanatory being kind of the way in which we explain and interpret things. So they have a tendency to interpret and explain negative events as being internally based, so due to them as opposed to external factors, and as a constant, stable quality. So, it's because of me, it's my fault this happened, and nothing's ever going to get better. It's always going to be just this bad. So an example might be finding a job after a layoff. So somebody who has a more pessimistic explanatory style, they might be more likely to say, the reason that I'm having trouble finding a new job is because of who I am as a person. It's because I don't have the right skills, I don't have the confidence, I don't have what it takes. Versus, explaining it as maybe the job market is just not that good these days. Maybe it's really hard to find jobs. You might be qualified, it just might be that the jobs aren't there. So if you have that pessimistic explanatory style, it can lead you to think of things in a much more negative way. Pessimism is often also linked with negative affectivity, which is the tendency to respond to problems with a pattern of anxiety, hostility, anger, guilt, or nervousness. So all those negative emotions, the ones that are associated, if you remember our ocean personality trait of the dimension of neuroticism, someone high in neuroticism would be high in kind of this emotional negative affectivity. And so negative affectivity makes it harder to choose an appropriate coping strategy for any given problem. So for example, negativity following a breakup. Somebody who is high in negative affectivity might be more likely to socially withdraw and become angry and kind of lash out, which can make it a lot harder for others to provide social support. Whereas someone who has a lower level of negative affectivity, they might find it easier to kind of help, heal by relying on others and turning to people in their social group for support, which, as we've talked about a little previously, can be something that's really helpful for coping. So optimism is also associated with better physical health than pessimism. Women who have HPV, which is the human papillovirus, sorry, I can't really pronounce it, but it's basically a virus that can lead to cervical cancer in women. They actually, when they tend to show pessimism and they have this HPV, they actually tend to have a lower white blood cell count as well, which of course your white blood cells are part of your immune system response. So you'd be less able to respond to threats to your physical health. Long-term studies have shown that optimists have lower incidence of coronary heart disease and that consistent pessimists have a 19% increased mortality risk. So 19% increased risk of dying, due to something other than, I guess, more natural causes. So although many may take these studies to mean that optimism causes better health, there is an alternative explanation. It could be that optimists and pessimists may simply have different lifestyles. So if somebody is optimistic and they think that the best is going to happen, they're more likely to plan for that and engage in activities and behaviors that are kind of more beneficial to their health, like healthier eating and exercising and things like that. Whereas pessimists, who really kind of think everything bad is going to happen anyway, they're more likely to engage in more behaviors that could have a negative impact on their health. So a longitudinal study known as the Nun study examined the handwritten autobiographies of 180 nuns. So basically they chose nuns because they figured it's very hard to kind of factor out a lot of those different lifestyle factors that might be influencing people, but nuns are all living kind of in the same, usually the same place with the same access to resources and things like that. So they figured that this would be a better population to study because you're eliminating a lot of those external influences. And what they found, they got the nuns to kind of keep journals, and the research found a strong correlation between positive emotions in young adulthood and longevity. So by looking at their kind of handwritten journals and autobiographies, they were able to determine that those that experience higher rates of optimism and kind of positive emotionality were actually associated with having kind of a longer lifespan. And here's just a diagram that kind of shows that positive moods can actually help speed up a person's recovery from negative events. So somebody who's more optimistic, if you view a video depicting kind of more positive emotions, so things like amusement or contentment, actually causes heart rates to return to normal levels faster than watching a neutral or a sad video. So if we can see that, overall people who see happier things and are kind of more content, they tend to kind of recover faster from things. That can show you kind of why somebody who has a higher level of optimism, which involves those positive emotions and things like that, might also have better health outcomes as well. So far in this chapter and in this module, we've discussed factors that can reduce the effects of stress and promote well-being, but sometimes negative life events are unavoidable, and individuals definitely differ in their ability to kind of bounce back. So resilience is defined as the ability to recover from illness or adversity, and resilient people tend to have one or more factors stacked in their favor, and personality, as we kind of alluded to in other modules, can play a role. So there's a really amazing example of someone known as Viktor Frankl. He was an Austrian psychiatrist whose family was forced into concentration camps during World War II. And so he found himself, even while he was suffering every day, he found himself in the role of trying to help others adjust as well, probably due to his training in psychiatry. So he was very much someone who was trying to help others as best he could who were in that situation. And so he found that one of the most critical parts of surviving these camps was to find some sort of meaning in life, which might have been one of the reasons that he worked so hard to help the others around him as well. So he essentially stated that despair equals suffering minus meaning. And what that means is that you can be in a state of suffering, be in a really negative situation, but if you're able to find some meaning and kind of try to work past that and kind of fulfill your meaning or your purpose in life as best as you can, that can really help influence whether or not you fall into a state of despair. So a key struggle then was to maintain a sense of meaningfulness. We often focus on negative outcomes of stress. It can be really hard, when we're faced with a very stressful scenario, to kind of think of some of the positives that can come from stress. But stories such as Frankl's demonstrate that stress and trauma can actually help people realize just how strong they are. So there's something known as post-traumatic growth, which refers to our capacity to grow and experience long-term positive effects, even in response to negative events. It is important to note that post-traumatic growth is not an alternative reaction to post-traumatic stress. So you've probably all heard of post-traumatic stress and how it can lead to what we call post-traumatic stress disorder, which is something that we'll get into a little bit more further in the next chapter on mental illness. But just because somebody experienced a traumatic event and they may be experiencing post-traumatic stress does not mean that they also cannot experience post-traumatic growth as well. The two conditions often occur together. Growth occurs during the process of coping, not because of the event itself. So you're not going to grow because something bad happened to you, but you grow as you learn to heal and cope with what happened to you, and you realize that you're strong enough to kind of make it past the event. So we shouldn't just be exposing people to traumatic events to try to kind of create resilience, but it is something that can be a more fortunate kind of byproduct of going through a really tough time, can be that you do learn how strong you are and you are able to exhibit some growth. So I apologize, this slide is going to sound a little out of place when you listen to the next slide, because this one was actually unintentionally deleted from the original slideshow, and I only noticed it after recording the next slide, which talks about a specific type of meditation. So you can just ignore the fact that I began that slide by talking about how meditation and relaxation can be helpful and effective in terms of reducing stress responses. So meditation is defined as any procedure that involves a shift in consciousness to a state in which an individual is highly focused, aware, and in control of their mental processes. So there are different types of meditation, one of which is known as focused attention, in which a person focuses his or her attention on a chosen object. And so basically they're trying to focus only on that object and just kind of, be in the present moment. If other distracting thoughts kind of enter their consciousness and interfere with their meditation, they're basically supposed to kind of accept them and kind of gently nudge their focus back to that object that they're supposed to be focusing on. There's another type called open monitoring, in which meditators pay attention to moment-by-moment sensations without focusing on any particular object. So there are a lot of different types of meditation that people can engage in, and it is something that has been shown to be very helpful sometimes in helping mediate really extreme stress responses. So there are numerous studies that have shown that meditation leads to decreased feelings of anxiety and has been effective in reducing blood pressure, which lessens the likelihood of experiencing long-term problems with hypertension and cardiovascular disease. So meditation and relaxation are some things that a lot of people find very helpful in terms of helping mediate their stress responses. There's something called mindfulness-based stress reduction, or MBSR, which is a structured relaxation program based on elements of mindfulness meditation. And so its primary goal is to help people cope and relax by increasing the link between one's body and one's mind. So mindfulness is all about being aware of your present circumstances and kind of living in the moment, and it can be really helpful at times in helping people cope. A lot of what we learn about, even in my doctorate program that I'm in right now for clinical psychology, a lot of the skills that we learn in CBT and in DBT training have to do with mindfulness and using mindfulness techniques. So a common technique in mindfulness-based stress reduction is called a body scan, in which participants pay attention to the sensation in each part of their body. This technique involves a great deal of attentional control. You really have to kind of be able to focus on what's going on in the moment and not become distracted by other things. And participants are instructed to recognize and become aware of emotions, but also to let them go. So to be able to kind of sit with your emotions and recognize that they occur without feeling like you have to react to them or kind of engage with them in any way, and just letting them be and letting them hopefully eventually subside. So studies of mindfulness-based stress reduction have found that it reduces stress and increases a sense of meaningfulness in life. And there is a complex form of meditation known as integrated mind-body training, which has also shown similar results. Yoga has also been linked to a decrease in emotional arousal and increased immune system function as well. So a lot of these mindfulness or meditation relaxation techniques can be really helpful and are associated with a lot of positive health outcomes. That's not to say they'll work for everyone. Personally, I don't really find a lot of benefit from a lot of the mindfulness-based kind of interventions, but they are something that's really effective for a lot of people, and they are something that's definitely worth a try if stress is something that you deal with on a regular basis. Church is another example of something that has been shown to have really positive health outcomes for some people. And again, I say some people because obviously we recognize not everyone is religious and not everyone kind of subscribes to those type of beliefs. But if you do have a faith system and it is something that you feel really strongly about, it can be a very good protective factor for you in terms of your health outcomes and other things. So many stress reduction techniques are sometimes associated with spiritualism, although belief in a higher power isn't necessarily required for their use. So even though a lot of yoga and practice like that do come from kind of a spiritual background, you don't necessarily have to be religious to engage in them. However, some people do use religion as their primary coping mechanism during stressful times, so they may use things like prayer, meditation, or religious counseling, all of which may provide strength and comfort through difficult times. People who are very religious do in fact seem to live a little bit longer than those who are non-religious, but this is likely due to lifestyle factors as well. So for example, it's probably not just because they're religious. It might have to do with the fact that a lot of religions actually restrict or prohibit things that we might engage in that are not necessarily healthy behaviors. So eating certain foods, smoking, risky sexual behavior, all of those things are kind of forbidden. Sorry, I was going to say prohibited and forbidden at the same time. They're forbidden by a lot of different religions, and of course, if you're not engaging in those risky behaviors, then it makes sense that you might be likely to live a little longer. So generally, people who are religious show greater well-being and lower levels of depression, but this can depend on the point of view taken, so positive versus negative. So whether you see your higher power as something who's kind of benevolent and kind of helping you and wouldn't be intentionally causing your suffering, whereas some other people might say, you know, if I'm such a strong follower, you know, why would you let me suffer like this? And they might kind of take it in a more negative stance in terms of kind of blaming their higher power for their current state. Exercise is something that might come as no surprise, that it can be really helpful with coping. I know a lot of people know this. Again, it's one of those things that's easier said than done, kind of engaging in regular exercise or physical activity. But we have seen that even short bursts of energy can be useful in producing physical and psychological benefits. So for example, students who sprinted in a task where they were asked to either sprint, jog, or do nothing were actually able to learn 20% more words in a subsequent vocabulary test. So it did seem like, for whatever reason, that burst of physical activity actually had an impact on the cognitive abilities of the participants. And they were able to kind of better attend to and complete a vocabulary test after engaging in this activity. So research indicated that students who engaged in intense exercise had higher levels of dopamine, epinephrine, and brain-derived neurotrophic factor, or BDNF, which is a protein in the nervous system that promotes survival, growth, and the formation of new synapses, so new connections within the brain. Cardiovascular exercise also provides immediate benefits in cognitive processing speed, and sedentary adults, so those who aren't really engaging in much physical activity, between 60 and 85 years of age who take up weekly exercise show improved brain functioning and cognitive performance. So as is clear from a lot of these studies, the bottom line is that physical activity and the benefits of exercise go a lot further than just helping you look good. They can also help you feel good and be more healthy as well. So often, unfortunately, we do see that the most stressful circumstances are the ones that we have little or no control over. So for example, children who live in abusive homes, they have very little control over or being able to remove themselves from that situation, or natural disasters such as earthquakes, tornadoes, hurricanes. And so laboratory experiments have demonstrated the negative impacts that a lack of control can have on health and behavior. So for example, there was a researcher named Martin Seligman, and he did a lot of research with dogs, and unfortunately his research was pretty sad. Essentially what he did is he shocked dogs while they were in a harness. And so half of the dogs were basically taught to press a panel to escape, while others were just kind of continuously shocked without kind of being given any option for escape. And so what they saw that happened is that later on, when they put the dogs in a different contraption in which one side was like kind of electrified for shocks and the other side wasn't, and there was a very low barrier that they were easily able to escape over, the dogs that had initially been trained that there was an escape, they were far more likely to kind of figure that out and just kind of escape the situation in the second scenario, whereas the dogs that had been unable to escape from the shocks in the original part of the study, they honestly had a really hard time learning that it was even possible to escape. So essentially, they were experiencing what's known as learned helplessness. And so instead of even trying to escape, they had learned from the beginning trials that there was no escape. And so they would kind of basically just kind of lie down and kind of accept their fate and whine without really even trying to escape. So the findings of this study, as I mentioned, they're described as learned helplessness, which is an acquired suppression of avoidance or escape behavior in response to unpleasant, uncontrollable circumstances. So if you put an animal or even a person in a situation that's kind of unavoidable and there's no chance for escape, they basically will eventually learn to just kind of accept their circumstances and not even try to make things better for themselves. So the important part about learned helplessness is that the animal or person learns that their actions cannot remove the stress in one situation, and then they kind of generalize that helplessness to other situations as well. And so you can see why this will be very detrimental, and it's something that's really heavily involved a lot of the times in our explanations of things like anxiety and depression. So a lot of the times, for example, if somebody is depressed, they tend to think that the negative events in their lives are something that is internal to them, so it's something that's wrong with them. It's not something external that can be changed. That it's something that is stable, so it's something that's going to continue happening to them, and there's no choice, they don't have any control over it, and it's something that is global, so it affects all areas of their lives. So basically they generalize that response to all circumstances. So you can see how that idea of learned helplessness, of kind of learning that, you know, there is no control of these bad scenarios and bad situations, that can really lead to someone feeling even more depressed and having a really hard time kind of recovering from that depression. So here's a little diagram from that study. Again, really kind of sad study, but it really did illustrate that concept of learned helplessness very well, and that is something that we have found to be very helpful in explaining certain mental illness and the reasons that people often have such a hard time recovering. So the idea of a random world in which people lack personal control over events can be very discomforting, but does having a sense of control lead us to better health? So the idea that there is some kind of randomness dictating the world can really create anxiety in people, and people often become highly motivated to try to find some kind of meaning. So in this way, many people tend to cope with stressful life events through what we call compensatory control. So these are psychological strategies that people use in order to preserve a sense of non-random order when personal control is compromised. So if they're faced with a situation where they don't really have any control over the outcome, a lot of the time people will engage in compensatory control strategies to kind of give themselves a sense of control and that they feel like they have some kind of control over the scenario. So for example, sometimes people who don't really believe in kind of a higher power, or they aren't really religious, when they're faced with, you know, a really intense personal tragedy or societal event, a really negative event, then sometimes they will actually develop religious beliefs in response to that type of scenario, because they want to search for kind of a greater meaning and purpose. People don't like thinking that, you know, there is no purpose and everything is kind of random and there is nothing to kind of to have control over. So in order to study compensatory control, researchers have developed a laboratory task that manipulates people's sense of personal control. So there's a concept identification task with two types of feedback. So they either get accurate feedback on you know, what they say they see in these images, or they get random feedback. And so I'll show you a little bit about what this kind of study. So essentially the initial task is just concept identification. So it doesn't really have to do anything with these images here. But the participants in that phase are either given, you know, normal feedback, that's, you know, okay, you were right, you were wrong, if you were right or you were wrong, which is something that, you know, makes them feel like they had more control over, you know, whether or not they got the question right, or they're given completely random feedback. So even at times that they were right, they were told they were wrong, or times that they were wrong, they were told they were right. And unfortunately, what this does, if giving random feedback, it makes the person feel like, well, they didn't really have any control over whether or not they got the question right, because it was all completely random. And so if they have this random feedback, they start to feel a lower sense of control. And they report this in kind of a more self-report measure. And so then, following that task, participants were asked to examine multiple pictures like those shown below. So basically they were asked to say if they saw an image in the pictures. And if you're looking at them, you might see in the image on the left, there is kind of a pattern with the dots that does resemble maybe a horse or a zebra or a donkey, something like that. On the right, there isn't really a discernible image intended for this image. So there isn't really anything that you are supposed to be seeing. And so basically they put these people in a position where they were either feeling very in control or they were feeling very out of control of what was going on. And then they showed them these ambiguous images and asked them to describe what it was they saw in the images. And so what they saw is that the people who felt their sense of control was undermined, they actually compensated by heightening their search for structure in the world. So the people who were getting the random feedback in the first task, and it kind of made them feel like they didn't really have any control over what was going on, they were more likely to attempt to find meaning even in those images in which there was really no discernible image, because they were trying to kind of increase their sense of control in their search for structure. So people also gain a great need for structure and become increasingly superstitious, and religion, as I mentioned on the last slide, may be used as a form of compensatory control. So these results may help to explain how people respond to lost control outside of the laboratory, but of course, as usual with laboratory research, there are limits to generalizability. Individuals who believe they can predict and influence present and future events tend to have improved physical and mental well-being. So it does seem to be that having, a high sense of control over your circumstances and over your life is associated with kind of improved outcomes. And here we see some further kind of results that were things we saw that were associated with having a higher or a lower sense of self-control. So we did see people who felt that they had a higher level of control were less likely to score highly on the personal need for structure scale. They were less likely to see images in snowy pictures. They were less likely to engage in superstitious beliefs or to hold conspiracy theories and endorse conspiracy theories. So we do see that having a higher level of control can be associated with a lot of more positive things, whereas if you were having a lower perceived level of control, you are more likely to see images where they weren't there, to engage in superstitious behaviors, and to kind of be more likely to endorse conspiracy theories. So that can be really helpful information for us to have when we're dealing with these kinds of behaviors, to know, where someone sits in terms of their feeling of the perceived sense of control. So finally, the very last thing for this chapter, and this is actually something that comes from the older textbook of a different book that I used to use for this course, but I like it because it gives a few really practical strategies that you can use in your everyday life. It is unfortunate, but a fact that some problems cannot be solved. So for example, an inability to have children, the loss of a job or a loved one, the development of a chronic illness, those are things that we cannot control. And so despite the fact that we may feel, a high level of perceived control in general, there are certain things that are unavoidable. But health psychologists have developed 3 effective cognitive coping strategies that we can use to at least help manage our response to some of these scenarios. So the first is called appraising the situation, and this one can actually be a very powerful thing to do. So I kind of alluded to it way earlier when we talked a little bit about reframing right at the beginning of this chapter. And essentially that's kind of all it is. It's basically just reframing or reappraising the situation in a way that paints it in a more positive light. So for example, if you get in a car accident and your car is totaled, you could choose to be really sad about it and, kind of mourn the loss of the car and, what am I going to do now? I need to get a new vehicle. Or you can take it as an opportunity to say, well, you know what? I wasn't really happy with that car. I'd had it for a long time and I was looking to get a new one anyway. So now it gives me an opportunity to do so. Obviously, that's not, it's a very optimistic way of looking at it, and it's something that a lot of people, it would take a lot of time for them to be able to kind of reach those reappraisals. But if you are able to kind of look at something in a more positive light like that, it can be really helpful in terms of dealing with the stress related to whatever problem you're experiencing. The second thing that has been shown to be helpful is learning from the experience. So drawing lessons and thriving as a result of the adversity. And I mean, I'm sure you've heard of this a lot. We talked about it a little bit when we talked about post-traumatic growth. But a lot of the time, people take the things that happen to them as a learning experience, and they kind of remind themselves, either be more careful or to spend more time with family and friends. They kind of take it, they put meaning to the event that's happened to them. And as we talked about even with Dr. Frankl during World War II, having kind of a purpose or a meaning can be really, really helpful just in general. So giving meaning to the negative events that occurred can actually be really helpful in helping us work past them. And the third is to make social comparisons. And this one kind of sounds mean in a way, but we can make comparisons in 2 different directions. We can either compare ourselves to people who are less fortunate than us, and that can be really helpful in terms of saying, hey, you know what, well, I'm doing pretty good comparatively, and that can kind of make us feel better in that way, which sounds mean, but you know what, it can be very effective. And then the other thing that we can do is if we are facing kind of a negative circumstance, we can compare people who have compare ourselves to people who have been in the situation and are doing a lot better now. So for example, you find out that you're diagnosed with, a certain type of cancer. Obviously that's going to be a really big blow. It's going to be something that's going to be very upsetting to you. But if we're able to take that and find meaning in it and kind of compare ourselves to, somebody, well, she's already had this type of cancer and now she's survived and she's thriving and, she's raising money and awareness campaigns and stuff, so she's doing great. So by comparing ourselves to someone who was in our position and is doing a lot better, that can be really helpful as well. I will say that this third point, we kind of want to take it with a grain of salt, because there are situations in which comparing yourselves to others is not effective, and it is something that we should try to not kind of engage in on a regular basis, because it can make us feel a lot worse at times. No one, we shouldn't be saying that just because someone else is coping better, we should be able to cope better, but sometimes it can be helpful to look for those positive examples to give us an idea of how things can get better for us. So that is the end of this module. I apologize. I think I actually made it a little bit longer than the other modules instead of shorter, but I do think it's a really important topic because, we spent so long talking about stress and how negative it can be and the bad things that can come from it, but in the end, at least we kind of went through a lot of things that can be really helpful and effective in helping you manage your stress. So hopefully you find at least a few things here that are comforting and might help you in future periods of stress. So I'll end it here. Thanks for listening, and that's the end of chapter 14. So we're a little ways off from this now, but once we get to this point, we'll be prepping for our test 3, and then we'll actually be moving on to my very favorite chapters of the whole course, which are those on mental illnesses and on treatments and therapies, which of course is something that I'm literally going to school for right now, and so hopefully I'll be able to share a bunch of really interesting information with you, and you'll enjoy those chapters as well. So I will talk to you in the next chapter.